Hi, how are you? This is Integrative Family Nurse Practitioner Damaris Maria Grossman. And today on Mindfully Integrative Podcast, we are having a mindful chat with Fadesire. Actually, she goes by Tobi, and I might have messed that up, and I apologize. It's Fadesire, right?
Yes.
All right, cool. And I apologize. But she goes by Tobi, and I just really look forward to you guys meeting her and us talking further. She is an amazing palliative nurse practitioner, and she does policy and help in the hospice and palliative area for many nurses and hospitals. And she'll tell you more about herself. And she's definitely living mindfully in many ways for her and her patients. So nice to speak with you today, Tobi, and I'd love to just see how you're doing. So how's it going today?
Thank you. Thank you. Thank you. Thank you for having me, Mariette. Thank you.
You're welcome.
It's been a wonderful day so far today.
Oh, good, good. So let's start off with something fun. Like, what is something that people don't know about you?
Well, a lot of people don't know that I have 8 sisters.
Wow, that's a huge family.
Yes, I have 8 sisters. So yeah. And I
Wow, are
have a
you
lot of
guys?
friends too. But sometimes when I'm like into my sisters, because I have so much sisters, they're like, "You've been quiet. What's going on?" I'm like, "No, it's never quiet. My phone is beeping and beeping from my sisters."
Wow. So do you guys live nearby? How is your holiday gatherings? Oh my.
So we used to, but I think no. Actually, this year, beginning of this year, everybody just kind of moved everywhere.
Hmm.
New York, New Jersey, Texas, Washington. Yes, we haven't been able to do any gathering yet, but
Hmm.
it gives us good opportunity to travel around.
Oh, that's true. Yeah, you get to go
Yes,
to
and
go to
we
meet
we do
different
have
people.
like a family group WhatsApp, which we talk and send videos and kind of
Oh.
like keep up.
Oh, to keep up with each other? Okay. Oh, that's
Yes.
cool. Wow, you're definitely have just in your family alone a lot to chat about probably.
Yes. That's why I
Oh.
tell my friends I've been busy. Sorry.
Yeah, no, totally. And I mean they probably are supportive or like it's cool because you guys can work together.
Yes,
So,
very supportive.
so tell me a little bit about yourself as a nurse practitioner and what you do and how you kind of like have been working in like in your field, but actually, mindfully kind of working.
So, nursing for me has been something that I knew I was going to do when I was little. I think I was 8 years old when I said I want to be a nurse. So, after my high school, I just delved into it. So, I've done like psychiatric, geriatric. There was a time I was concentrating on Alzheimer dementia. And then I fell in love with rehab, did rehab for like a couple of years. And then I went back to school for nurse practitioner, but I mainly did adult and geriatric because I know I love older people. And
Right.
after some years, I have a couple of patients that felt like something is missing, even though we're giving them like the best care possible. And then I started looking into palliative. And then, palliative and hospice is interrelated. And I love how palliative look at patient in a holistic way. We're not talking just about the disease, we're talking about their feelings, what's affecting them emotionally, family. We get social worker and get all the discipline and just kind of help them as a whole instead of focusing on the disease process itself.
And I mean,
So
that's what we're here for right now. I mean, that's what we're talking about, integrative and trying to not just look at just what their diagnosis says that's come up, that we're trying to look at what, the whole process, right? So
yep,
we're trying to
yep.
get to the root cause. We're trying to look at the whole picture, the whole health. And that's just part of it. Now, can you go into detail a little bit of what palliative and hospice care is? Because some of our listeners may not know what that is. And I would love them to really understand that because it's so important.
Yes. So palliative and hospice kind of go hand in hand. And the main thing I want people to take out when it comes to palliative and hospice is we focus on treating the symptoms. Any annoying symptoms, stuff that is not making patient have good quality of life, we focus on that. And apart from doing that, we also focus on their needs and their general need. with thinking about their psychosocial needs, spiritual needs. So I feel like they're both the same thing. The only different thing between palliative and hospice is with hospice, a doctor would have said that without seeking aggressive treatment in 6 months, this patient might die.
Okay.
Yes,
So the
that's the
transition to
only difference. But
end of life.
yes,
Okay.
so it's both of it is
That's
end of
really
life.
deep. Like I mean, I want people to, listen here, they are not may not be in the medical field or such, but your work in itself is you're taking care of people in their end of life. And that in itself is huge. Not just huge for the work, but on a holistic and spiritual way, in a mind body approach, like you're trying to kind of bring them back to like a peace, and
Yes.
I think that people, I mean, it tears me up because I think about my dad that passed this past year. And I just think
Oh,
that he didn't have any sort of hospice care or palliative care because we were because of the pandemic and stuff. And I'm not just saying just for my father, but I'm saying other people. It's a very sensitive and emotional time for people, and people, they need like that, they need people like you. So
yes,
I can imagine. What
yes.
brought you to this? Like, I mean, someone doesn't just say, "Hey, I want to do this." What was a struggle or something that inspired you to like come to this conclusion? Or was there some story in your past in your life that brought you to kind of say, I kind of really, these are my people. These are the people I want to help.
Yes, there's a couple of stories that brought me there. My last job as a nurse practitioner working in an inpatient. I was the hospitalist on call at nighttime. And sometimes I will see us transferring patient back and forth and back and forth. And we know they're at the end stage of their disease. So I had to take care of a patient. It was pretty much my age, in his early 30s. He had liver cancer, and we would talk, and all he wanted was to throw a last party for himself, you know.
Oh, that's beautiful.
Yes, it was just like, I want to go back to my apartment, throw a last grand party. And we were like, we're waiting for you to get discharged, we want to see this party. And he was never able to do it. Like one morning
Oh,
he coded, and yeah, he passed away when we transferred him to acute hospital. And looking back, I was like, okay, he was having pain issue that could have been treated at home.
okay.
He could have his own last party. We already know it's the end of
Life.
disease, illness, and his end of life. But nobody really talked to him, and I didn't know really much more about that. So
Mhm.
I always feel bad that I didn't help him in accomplishing that.
His goal to kind of just to that it wasn't a large like ask,
Yes.
and I think that there's individual, like you're right, and they should be home. Like it's like they need to be home, they need to be, or at least in a
Mhm.
place of
Whenever they
uh
call home,
right, or some
their
place
loved
that, right,
ones.
that they feel comforted. Because sometimes
Yes.
like in a with all the tubes and all of those items, and ICU isn't the place for majority of the, but it is I would say your job is very difficult, but also to make that call is difficult too. For families, probably even, I can only imagine what it's like, not just for the patient, but for you to talk with these families.
Yes, it's very hard to talk to a family or even bring palliative or hospice. It's very hard. But I always like to let them see the benefits of it. I'm telling them we already know the disease process, we already know what's going on. But now let's look at you as a whole. What would you want? What are your goals in a few days, few months, whatever days you have left? How can we accomplish all these goals? Which it can be. Some people just want to talk to their mom, or they want to have one last party, or they want to gather the whole family and talk to their siblings. Some just
Mhm.
want ice cream.
Some just on ice cream. Oh, that's so cool.
Yes.
What kind
And
of like benefit, like what benefits do you tell them that it will do for, like, will help them with, like when you're saying, because we're talking, you're saying a holistic, mindset, and how do you approach that to someone, like when you are talking to them, because you obviously are looking at the whole picture, right?
yes. So I talk to them about the benefit of spiritual counselor. Again, mind, body, spirit, when we're looking at the holistic part of care. Some
Yeah.
people have spiritual stress. They're like, why me? Why did God do this to me? I've always been faithful to him. I go to church every time.
Oh.
Some people
Mhm.
is more physical. They're like, I worked out all my life, I eat healthy all my life. How did I have this disease? I mean this pain. So we focus on the pain. Psychosocial support too.
Yeah,
We
I mean wellness is many elements as I talk about with people. Everyone's like it's not one pill, it's not one thing. There's the faith component, the psychosocial, there's the chronic pain, and then now you're also dealing with their 5 stages of grief probably on top of that. So
yes,
they're, instead of achieving optimal wellness, they're trying to live in their end of life in a wellness way, right? And that's
yes.
difficult.
That's very odd.
And that's kind of them either coming to an acceptance, right? Or the stages, whichever, wherever they are.
Or they're
And wellness is
anxious
like
about
different,
that.
right? Oh, that can be very challenging.
Yes, that could be very challenging. We see patient keep asking me like, when do you think I'm gonna die? How's it gonna happen? Is it gonna be painful? Now they're getting very anxious about that.
Mm,
So I just tell them the process, what to expect, what we can help them with, control all the symptoms, make sure they are pain free, give them medication for anxiety, make
yeah.
sure they're not having shortness of breath, any symptoms that will make them, a little bit more anxious, we try to work
To
on
work
that
with.
very
And
well.
do you sit with them? Do you pray with them? Do you cry at them? Like
Oh
about
yeah,
everything?
because
Like
you get connected with them.
oh,
Even the family, I still get like messages from them. We take pictures. Some will record a voice note for their loved ones too, so that
oh,
they
that's
can
beautiful.
listen to it. Yeah, they can listen to it
Mm.
afterwards. Yeah, I kind of go above and beyond and do stuff most hospice probably don't do. But
It's because you love it, and this is what
yeah,
you're supposed to be doing. This is what your purpose is, and that's
yeah,
beautiful. And this is a difficult, stage for most families to handle.
yeah,
You know.
very. They need good support system. It can be a lot on our old team too. This is just not just me, the doctor, the social worker, volunteers. It
Mhm.
can be a lot on us. So we do grief support for our team too.
Oh, so you're helping, kind of like helping the healthcare workers too.
Yes,
That's
because
important. Self care for
oh
them too.
yes, because when you go there, everybody's telling them their feelings, they're crying on your
Yeah.
shoulder. You're the strong one helping them through, and then you get them, you're like, oh my God.
Yeah. No, I'm already emotional thinking about all those people. It's a really tough time. I remember for myself, I was a lot in pediatrics.
Oh, I
I'm a nurse
can do that
practitioner
one.
in pediatrics, and I've done pediatrics palliative for a lot of special needs. And I remember doing a little bit of it. And that was because we had a lot of cancer kids, and it's those moments, but you try to be as like the children were so beautiful about their majority of them could really handle it so much better than the families. And I'm thinking back of it just makes you cry. You're like, oh, I just but that's part of that thing where you're like, no pill is going to fix this situation, and there's no
Yes.
one diagnosis that'll fix this moment. And to me, that's why, like, an integrative approach and a mindful way of thinking of it is just so much more, and it's so important. And I love meeting different people and what they're doing. um is there like an inspiring person or quote or something that you come to, what if it's the Bible or just a general code or a picture, someone that you've come to that like kind of like helps you?
Um, I would say the person that have inspired me a lot is my dad.
Oh, that's cool. And how is
He,
that, and why is that?
he's a doctor, and back home in Nigeria, he did a lot of pretty much just helping people. I see how he takes care of people, and they don't have money, and there's no insurance, so they just beg him, and it's like, oh, okay, I guess at least you feel better now. So that's very
Oh,
inspiring to me. And he also kind of ingrained in me to be thankful at all times, regardless of what's going on in my life.
yeah.
So everybody knows when they come to me in the good and bad, or they're complaining, I'll be like, be thankful. It can always be
Mhm.
worse. So that's my great quote. Always be thankful no matter what you're going through.
And that's hard to tell, like for someone to understand, but you're trying to say to them, hey, it's okay, like, but
It could be
you're
worse.
seeing it because you know what could be worse, and you're trying to give them a little bit of open-mindedness, right?
Yes. And tell
Yeah.
them to be positive or even speak positive into their lives.
Yeah, I agree. Um, I want to kind of, I know that you've discussed a lot about your palliative business. You have a business on top of being a palliative nurse, correct?
Yes, I do.
And how is that like for you? Like, I mean, having a mindful way, I think that's probably who you are. But how is that for you in your life in general, in your business, in your, like, tell me a little bit about like an everyday or in the day of life for you. What do you do to help
In a
you
day
be a little
of
bit more
life for
mindful?
me, especially with starting my business and having little toddlers, the first thing I do in the morning, I do like my daily devotion, do like 1 minute, 2 minutes
Yeah,
prayer. My
whatever you.
prayer is, I would say 3 or 4 points of it is to thank God for different stuff. I speak it out, what I'm thankful for. The next thing, I kind of write out what I want to accomplish
Yeah.
in the day. And I do a little bit of stretching exercise.
Oh, nice. Yeah. See, I don't always get to write down everything with a little one too. I'm also a mom, a young mom. But I love that you have a daily devotion, even that few minutes with before they wake up kind of thing, right?
Oh, yeah.
I totally get it. You're an integrative mama too. Um, and then in your business, or tell us more about how we can get a hold of you. Or is there anything upcoming that you're doing, or a way that the listeners can reach you? And then do you have any additional advice too, to let us know?
The name of my business is Shiloh Hospice. And I
Shiloh
came up with
Hospice.
the
Oh,
name Shiloh because it means peaceful.
peaceful.
And
Oh,
yes. And you can reach us at info@shilohhospice.com. We also have a website, www.shilohhospice.com.
okay.
And
I'm going to have those in the show notes. And are you guys having any upcoming events or anything that you're doing that you'd like to talk about today?
right now, most events that I do are on Shiloh Hospice Facebook. I
Great.
do a little discussion about, I think the next one I'm doing is going to be end of this month. I'm
Perfect.
going
Yeah,
to be
we can
talking
put a
about
link to that.
frequently asked questions. Like when people call me or when family call me, I'm going to talk about what they asked me about. They asked me about how many times is the nurse going to come? How many times is the hospice aide going to come? When is this coming? So I put all those questions together and I would discuss and talk to people about it.
That's so important because I bet you one listener right now has somebody in their family that is going through hospice or needing hospice or an end of life situation where they have questions. And, long term, you could even make a whole course on how to help these families and healthcare providers. So that's another element. And I look forward to maybe even you being on the show again if you have the time, at some future
Yeah,
time.
this is
All right.
wonderful. Thank you so much for
Oh,
the
I would love it. I would love it. I really appreciate you taking, your time in the day to speak with us and speak with the audience and listeners. And thank you. Really, it's been such a pleasure.
Thank you.
And I just wanted to say that we're grateful for that. Um, Anything you want to add before we go?
Oh, before we go, I want everybody to take care of themselves and not just the physical part, the emotional part. It goes hand in hand.
It goes deep, right? It's more in. It's
Mhm.
more in than out. It's like take care of the in and the out will come, right?
Yep, yep.
Yeah, I love that. So thank you so much for joining in on Mindfully Integrative Podcast. I am Dr. Damaris G, and we had a wonderful mindful chat with Tobi today, our expert palliative and hospice nurse practitioner. And make sure each and every day that you have a mindful way. Thanks so much for listening in. You guys have a wonderful night.